Hello and welcome to our special series, Love You Zindagi, where we embark on a journey to discuss issues that are not only close to our heart, but also demand immediate attention and action. We will also come face to face with extraordinary people who've overcome all odds to say yes to life. In today's episode, we look at the issue of mental health. Did you know that 1 in 20 Indians suffers from depression? And nearly 15% of Indian adults need active intervention for mental health issues. But despite this, mental health doesn't get the attention it deserves in the country. We need to acknowledge that it is as important as our physical health and an integral part of our well-being. Today I'm joined by an esteemed panel, and we'll discuss the burden of mental health ailments in the country. I'm delighted to welcome all my special guests on Love You Zindagi. Shweta Rawat is founder and chairperson of the Hans Foundation. Thank you very much for coming.
Thank you.
N. Ram is senior journalist and chairman of the Hindu Group of Publishing. Dr. B.N. Gangadhar is director, National Institute of Mental Health and Neurosciences, NIMHANS. And Dr. Vandana Gopikumar is co-founder of the Banyan and the Banyan Academy of Leadership in Mental Health and Professor, School of Social Work, Tata Institute of Social Sciences. And we have a wonderful audience. Give them all a very big hand. Now, before we start this very important discussion, I'd like to share with you that we spoke to Oscar-winning musician, the one and only A.R. Rahman, about why mental health is important for all. Not many people know that even this brilliant man fought depression and suicidal thoughts at the age of 25. Listen in to what the great A.R. Rahman has to say.
When I was young, I was looking at myself, looking inwardly, and discovered that when the mind is happy, mind is secure, we can achieve great things. The moment we control our own minds, the moment we keep our minds healthy, our life changes. There are now millions of people who can insult you on Twitter or on social media. But does that count? He's not going to come and feed your family. You have to. As a head of your family, as a part of your family, this is one thing I realized, and that changed my life. That mental health is very important. A man or woman who's happy in family can achieve greater things. If they have problems at home, it reflects on the job, what they do, how they influence others. So, the most important thing is in a family, in a society, we keep each other happy.
The great A.R. Rahman, they're giving us a sense of what it's taken him to conquer the problems of mental health. Dr. Gangadhar, 3 out of 4 persons with a severe mental disorder experience significant disability in work, social and family life. Neurosis and stress-related disorders were reported to be higher among females than among men. Why is that the case?
Mental illness does produce disability. And if you treat them promptly, the disability comes down. And a proportion of them will be able to manage very well. And about close to a quarter of them need some support or other at some point of time, depending on the nature of illness. Severe mental disorder, more support is required, and mild mental disorder, they will recover totally and will be all right. Yes, of course, more women suffer from minor mental disorders than men. The ratio is about 3:2.
Do you agree with that comment that part of the problem is you need these support structures, and if they're not there, that's when the problem gets aggravated?
Yes and no. So the part that I agree with is that it is true that with early identification, a lot of people with mental health issues, particularly common mental disorders and also severe mental disorders, can be treated and can be part of mainstream society. But what is also true, especially in a country like India, where 70% live on $2 or lesser, there is an interaction between poverty and mental ill health. That results in disability. So when you unpack the phrase disability, it is not so much about the clinical symptoms, but it is more about environment posing barriers.
You know, it's interesting that we are discussing mental health because as I said at the start, it's an issue which exists around us, but we don't talk much about it. Now, the Hans Foundation that you set up, Ms. Rawat, has engaged in what's called the development sector. You've touched the lives of more than 7 million people in the fields of health, education, disability, livelihoods. So why now turn to an area like mental health?
So the Hans Foundation is 10 years old this year. In 2009, when we created the foundation, it was always the goal to provide holistic development and be an agent for comprehensive development. And that's why we looked at disability, education, and healthcare as intersecting spheres of work rather than silos in the field of development. And as you said, and as we all believe and know, that healthy mind and healthy body together make a healthy individual. So disability was always a prime focus for us, and within disability, mental health was always a prime focus. As a young agency, for 2 or 3 years, we funded a lot of disability organizations across the country, and we constantly came across issues of mental illness and still the level of prejudice existing in the country, a lot of censorship, and it just kept coming back to us that this is an issue that we have to tackle at some point, and we have to provide some sort of change to the scenario in India. So we have now looked at mental well-being, especially with a focus on women and girls and children and the youth as a key area of THF's work.
Mr. Ram, the obvious question is, where is the media? Where is the systematic media coverage of mental health issues? In our obsession with politics and all that happens in and around politics, there is very little focus on these critical issues of life.
Yes, I'm afraid that's true, Rajdeep. You and I know that. It's a well-known weakness of the media, well-known syndrome, you could say, that when it is silent, when the profile is very low, we are not good at covering it. And the whole idea of programs like this is also to educate the media, to instigate positive action by pointing out that in this sphere also you are not doing well enough.
We as a nation have a lot to work upon and improve in the field of mental health. But there are some entities like the Hans Foundation which are striving to make a real difference on the ground and ensure that people with mental illness can lead a life of dignity. Let's take a look at some of the lives that they've touched. Take a look.
On my way home, I remember when I used to be hidden behind large walls that kept me away from the world.
My mind took me to dark, confusing places. I was shunned by my family and society, labeled as crazy and cast away. But I'm restored.
I was kept alive by my love for my daughter. I am a mother, you see. I stayed alive for my sister, widowed and alone. I am a sister.
I found friends who were kind to me. I'm a survivor.
I've known pain, but I have courage. I've known fear, but I have faith. I'm back home now, and I love life.
என் பேர் கோசலை,
அஜய்,
ஜானகி,
ராம்குமார்,
அமலி,
லோகேஷ்.
Building a community that celebrates inclusion and diversity. The Hans Foundation.
And keeping in with that spirit of inclusion and diversity, I'm joined by a very special guest. Please welcome Amali. Amali, let's first talk about your condition. Tell this audience, tell the world at large about your condition.
பேர் அமலி.
Amli is from Trichy. She has a sister who suffered a severe mental health issue and was rendered homeless, after which she was taking treatment at the Banyan. Amli sought her sister out, and when she came and she encountered her own demons at that point and realized that she also has a severe debilitating condition called depression, and she started taking medicines for it, and she started doing well, but now she's trying to see if she can live without medication. And she's also lived with her husband had died by suicide, so she's faced multiple layers of poverty and isolation, because of which, as a result of all that, her depression became even worse.
And what was the biggest challenge she faced in overcoming depression?
So the loss of a livelihood, as a result of which she lost money, she lost social standing, she lost support, and she didn't have money to even pay for food, which is what really made things worse.
And how did the Hans Foundation then help you?
As a person with a mental health issue, she is now caring for, she leads a program with 30 people who have been institutionalized and now are living independently in the community thanks to her and her sister, who have taken a leadership role. And she wants to thank Hans Foundation for that support.
I have to ask her this question. You know, before the show, she had this bright smile, which she can give us again. And she has this incredibly positive attitude towards life and future plans. Where does this positive attitude come from?
She's a homeowner now, and she wants the 30 people whom she cares for to become homeowners as well. So that's her ultimate aim.
Wow. Amli becomes a symbol of what is possible. If you can inspire others. Which is why I want to turn back to A.R. Rahman. Because, in a way, A.R. Rahman becomes a role model of what is possible if you can overcome mental depression. Let's listen in to A.R. Rahman once again.
Human beings, in totality, whichever country, as a whole, we are interconnected. If there's suffering somewhere, it's like your body. If my left hand doesn't work, I can't do half the things which I'm supposed to do. Same way, I think suffering in any part of the world, whether it's India or the rest of the world, if there's suffering, that means we are affected in a way. Our whole potential, our collective consciousness of human beings are limited because of that. What seems fun in throwing stones will become actually a throwing on yourself. And we realize that much, much, much later. The word acceptance is very, very important. I discovered this probably after I was 25, that a person who's rich or poor, everybody has a meaning. So nobody is a waste creation. When we give, we get. It could be money, it could be love, it could be respect. I think we should find ways and be inclusive to these amazing people, heal them with a love and care and respect.
To look ahead. Shweta Rawat, you set up a national level multi-stakeholder task force to carry out a study titled National Strategy on Inclusive and Community-Based Options for Persons with Mental Health Issues. What was the directive and scope of the study?
So it started with an incident, actually. Our CEO, General Mehta, and I had visited the Pavlov Hospital in Kolkata, and we learned and interacted with some of the residents there and found out that, with the right care and the right support and medication, they could very well live healthy lives, inclusive lives in society. But after leaving the hospital, and they had gone back to their homes, and probably because of intolerance in their family or prejudice in society, they had returned to the institution. And it was a little alarming to think that this kind of institution, where they're in locked wards, was actually the safe space for them. And that got us thinking about what we could do. Are there really many people in the mental facilities in India that really could live outside? And if so, what can we do to achieve anything for them? And that was kind of where the seed of the study was planted. And we worked with state actors. We had agents from NIMHANS, we had agents from the Ministry of Social Justice, Ministry of Health and Family Welfare, and then non-state actors like Banyan and Anjali, which is a Bengal organization, IBHAS, which is here in Delhi. So we wanted to make sure that the research we did was valid and current, And the directive basically looked at 43 such facilities across 26 states. And we looked at long-stay patients. So anybody who has lived in the institution for more than 1 year is considered long-stay. And we wanted to get a right number, so then we can come up with recommendations and an action plan.
Dr. Gopi Kumar, what were the main findings of this study?
The critical findings were that there are 4,935 persons with mental health issues who have been living in hospitals over 1 year or more, which is about 36.25% of the total number of people in hospitals with severe mental disorders. There are more women than men. 55.4% of the people were referred by police or magistrates, indicating possible history of homelessness. The majority, 77.1%, were living in closed wards. Now, this is sad because what happens then is that you don't have access beyond the walls. You don't interact with neighbors. You don't visit a temple. You don't go to a movie. So you are hyper-segregated, as a result of which the prejudice or stigma or discrimination that Mr. Ram or Dr. Gangadhar or Shweta were speaking about is enhanced. And people then view you using a singular lens, saying that these are people with disability or mental health issues, and they ought to be away. So social mixing doesn't take place, as a result of which stigma cannot.
What is the role you believe the state must play and civil society? You know, you've got organizations like the Hans Foundation or the Banyan, you know, who are coming through civil society. What role should the Indian state be playing? You know, where does the Indian state ever talk about issues like mental health?
Here I would rely on this excellent report supported and brought out by the Hans Foundation, in fact commissioned. The National Strategy for Inclusive and Community-Based Living for Persons with Mental Health Issues. The first thing the state should do is must undertake the task of leading this effort. The state must be the primary actor in this, and it must commit fully to community-based, providing opportunities for community-based living for people who are professionally assessed as being fit to go out. Yeah. There's no access to these places. Secondly, the state must commit resources and come out with targets. Let's say by 2020, 22 or 25, how are you going to bring down this gap from, if the baseline is 70, then will you bring it up to 55 or 50 or whatever? Make your promise, and this has to be monitored all the time. Secondly, the report talks about the need to have a national steering committee under the aegis of the Ministry of Health and Family Welfare, and also state steering committees, which must be made responsible for achieving these targets and for fulfilling this commitment.
I have a quick point in addition to what Mr. Ram made. It is the state's responsibility. And what unfortunately happens is, while we've made significant strides in terms of the National Mental Health Program, the District Mental Health Program, and reforms in hospitals, but unfortunately this subject of people with severe disability, right, and rehabilitation somehow falls between the cracks between the Ministry of Health and Social Welfare or Disability. Now, this is not something that we should be concerned about. The government has to take cognizance of this, because these are the most disadvantaged. And if we don't focus on this, history will judge us very poorly.
Dr. Gangadhar, along with this is the big issue that is often referred to in the media, suicidal risk. You know, the high suicidal risk is seen as an increasing concern in the country. How much does mental illness contribute to that?
Mental illness contributes about 30% of suicide.
30%?
30%. A lot of other things, there are many other, suicide is a multifactorial thing. For every one person who actually has committed suicide, there are about 20 others who would have expressed and shared and would have been shown to have attempts in the past. And for every one person who has completed suicide, there are about 200 people who would have casually expressed it somewhere. If we are able to actually locate these people who have informally mentioned, off the record, if you can pay attention to that population, the suicide can be reduced. Suicide is an issue.
Yes. May I just add on this point alone, helplines and media are very important.
It's fascinating listening to this, because there are obviously solutions out there. Yeah. Ms. Rawat, from the findings of your report, which you spoke about earlier, this whole vision of an inclusive society, can you outline the recommendations of the study that, will actually result in inclusive India being a reality, not just a catchword?
After reviewing the study and looking at all the indicators that came out of that, what particularly stood out to me was I think the approach needs to be consistent across the states. I have an example of a state in the north, Uttarakhand, where we have actually tried to replicate the home-away model, and we have taken women from the institution in Dehradun and are trying to establish them in a community-based supported living structure. And so far it's working out pretty well, but we could not have done that without the support of the state government, without their voluntary and very enthusiastic approach to the whole project, as well as finding the right partners on the ground. So the consistency of the model has to work in all states. And every individual who is removed from an institution should have the right to decide how they want to live their life, what preference they have. I think family reunification is the first and foremost approach. We all want to have everyone united with their families. But they also have a right to say, you know what, I want to live with 2 or 3 of my friends in a house, in a society. I want to go watch a movie when I feel like it. I want to go and get involved with the society. And every person has that right. And I think last but not the least, the responsibility of the state, as the panel has stressed enough, every state agent is responsible, first and foremost. Civil and non-civil actors have taken this initiative, and we have made disability a priority for the foundation. But I think for the 150 million people in India living with mental illness, living with a disability, we would love to take that responsibility, but I think that the government of this country and every state government should make that a priority for themselves.
Yeah. Yes, I want to go to a couple of people who have questions. Yes, ma'am.
I want to know, is it necessary, is it important, or there is a need to train the mind to be in a state of positivity? Because in school it has become very common. And so we always, finding ways how to control it.
Most of the people dying by suicide are in the age groups of 15 to 29. This is also the stage in which most adolescents are going through several transitions in their life. So I think it's important to work with teachers and diverse stakeholders, but also with parents and children themselves to present an ideal of how society should be. And I go back to what Rahman said, that all of us are connected as a world, but what we see in reality is inequity. What we see in reality is disparity.
Now, I just wonder whether schools should have a course in how to build an inclusive India. Thank you all very much for joining me. Wonderful to have them. Give them all a very big hand. We have a long way to go when it comes to mental health, be it generating awareness, improving access to medication and therapy, mobilizing efforts in support of mental health, building up family structures. But we salute all those individuals and organizations who are working tirelessly for the betterment of people suffering from any kind of mental illness. A big thank you to all our special guests who took time to join us for this wonderful discussion. With that, it's a wrap on today's episode of Love You Zindagi. Thanks for watching. Bye for now.